Hi, this is continuation from week 3. Sorry about the break. We're looking at shock, and we're starting off now with the steps. There are 7 steps to shock. The first step is the calling for emergency services. Once we've done that, we then can get the victim to lie down and rest comfortably, control any bleeding, prevent the victim from becoming chilled or overheated, because that's really what's going to cause the full-on shock to occur. And finally, not finally, but to reassure the victim, because you don't want them to get all panicky. What we then do is we elevate the leg about a foot. Unless you suspect the head, neck, or back injuries or broken bones in the hips or legs, then you leave them flat. But otherwise, you will always elevate the legs about a foot. Don't give the victim anything to drink. Okay. Now we look at the fainting or a diabetic emergency. What we're doing now, again, these are going into more detail. These are going into more detail than the previous week. And here we're looking at if a person is diabetic, we look at whether they are hypo or hyperglycemic. We looked at that last week in terms of high insulin, low sugar level, or low insulin, high sugar level. If they're unconscious or if they're conscious, depends how you will treat them. If they're conscious, then you can give them something to drink. Generally, there's something with plenty of sugar, such as sweets or fruit juice or cola. And if they're suffering from low blood sugar, then the sugar will help in minutes. If they feel ill because of the high blood sugar, then they will not be harmed by any extra sugar. So that's the reason why you can give them sugar. If the victim doesn't feel any better after 5 minutes, then obviously we'll call the emergency services. Okay. Sudden illness. For any sudden illness, we've spoken about any of the life-threatening sort of conditions, we call emergency services immediately. We help the victim rest comfortably and prevent them from getting chilled or overheated. We also reassure the victim and monitor their consciousness. Don't give them anything to eat or drink unless they are fully conscious. If they vomit, then you put them on their side to prevent them from choking. If they faint, then you position their back, elevate their legs about a foot. If you don't suspect head, neck, or back injury, a person about to faint becomes pale, begins to perspire, and they lose consciousness and collapse. So remember, if the head is pale, raise the tail, which refers to returning the blood in circulation after fainting. Okay, so you raise their legs to get the blood back to their vital organs. If they have a diabetic emergency, then you will give them any form of sugar drink or sweet. If they have a seizure, don't place anything in their mouth. Remove any objects that could harm them. Cushion their head with a pillow, folded blanket, anything like that, and move yourself out of the victim's range so that they don't thrash out violently and maybe get you injured as well. After the seizure, make sure the airways are clear and you place them on their side. And if there's any blood, saliva, or vomit in their mouth, then you can make sure to take that away or to clear that. All right. Now we get to the final part, which is the summary then of all the first aid symptoms and treatments. And again, this list is important to learn. The students will have to go through each of them, starting off with the ailments, the symptoms of the ailments, and then how to treat it. Okay, so going through this, we'll just mention a few. Appendicitis. This one is a pain in the right lower abdomen, and it causes nausea, possible vomiting, and fever. So it's the right lower abdomen, appendicitis. All right. Again, for something like this, never give anything by mouth, and you can reduce the comfort by giving them ice or something to cool it down. Burns and scalds. We've spoken about this, if it's severe or not, if it might blister or it might be severe. What we do again is for small burns only use ice, otherwise we'll use cool water, running water. Okay. Okay, I'm just going to turn this around here. All right. I think that might be a bit better. We look then at the convulsions, which are strong jerking movements, and here we look at things like stiff body, difficulty in breathing, a bluish face, eyes rolling back. For convulsions, obviously we'll call a doctor. It could be many things. He can hurt himself, he can get strained, he can get hurt, broke bones, whatever. So just make sure that that's under control and call the doctor. If there's croup, that's to do with the lungs and the breathing. That's very, very loud breathing. Again, you call your doctor. And humidifier helps here. Turn on the shower. Keep door and window closed so you can try and get nice, humid, moist environment. Dog bites. Again, if the skin is punctured, then and you can see teeth marks, then you will have to obviously clean it, wash with soap and water, put a sterile dressing and bandage, and if there's rabies, obviously, then you will have to then, unfortunately, try and get help with the rabies and report to the doctor or hospital. Anti-tetanus is generally given, injection, and this will help in preventing the symptoms of rabies. Drowning, again with drowning, there's unconscious and there's no breathing, and also heart may have stopped. So what you do here is you check as you do for rescue breaths, for CPR. You check if the heart has stopped, then you do CPR. If there's no breathing, then you do rescue breaths, etc. Keep them warm and don't give them anything to eat or drink, obviously. If there's any fractures or dislocations, you'll see the severe pain, you'll see the deformities, you'll see the loss of motion, and in severe cases, you'll see the broken bones protruding through the skin. And here again, don't move those injured parts until you've got the splint in place. We've spoken about the type of splints that you can use. And you will then put the person lying flat, call the ambulance, cover the wounds, etc., and keep them warm. Gas poisoning. Here, you'll see that if there's a gas poisoning, there will be dizziness, pale unconsciousness, headaches. You open the smashed window and doors, open or smash the window and doors, and you get fresh air. You give them mouth to mouth, and if there's no pulse and you do CPR, keep them warm. If you have a heat stroke or exhaustion, you'll see either they're vomiting, flushed and confused, that's a heat stroke, or for heat exhaustion, they've got headaches, clammy, and possible nausea. And here, you will put cold clots to their skin, just like you would in a fever. Salty fluid like chicken soup or broth, anything like that, or one of the Pedialytes or electrolyte solutions. And if they got heat stroke again, then you just have to obviously call the doctor and emergency. If there's a heart attack, this is you'll see a persistent chest pain radiating from the left shoulders and arms, difficulty in breathing, lips, skin, and fingernails will turn blue. You obviously call emergency immediately, the ambulance, place them in a sitting up position, and use pillows for support. Keep warm and loosen the collar. And you can do CPR, because obviously a heart attack means the heart stops. Otherwise, you can give mouth-to-mouth resuscitation if the breathing has stopped, and you don't obviously give anything to drink or eat. Poisoning. Very often, boy poisoning, there'll be vomiting, drowsiness, mouth burns, stomach pains, and you will call the poison center or doctor, and you can also give something called syrup of ipecac. Don't force liquids or induce vomiting unless directed, because if it is an acid or something that will cause harm to the skin, then vomiting will just cause it to affect going up the throat again. Strokes, for this, you'll have unconsciousness, heavy breathing, weakness in the face, limbs, and very often inability to speak. Here we cover the person with a light blanket, you turn the head of the vomiting patient to the side, and you give no stimulants or anything to eat or drink, and of course you call an ambulance. And shock, again due to injury, illness, or poison, or any of the things that we said. There can be a mottled face, it can be cold sweat. Here we keep the person warm, lie them down, feet raised, call a doctor, no fluids or food. Open the airways, lower their face or jaw. If their face or lower face injuries are affected, or they've got unconsciousness, then you can lay them side to drain. Avoid any rough or excessive handling with shock. Reassure them. All right, guys, so this is the end of the first aid module 3, week 3, and the final module is going to be the assessments. So what I'll do now is I'm going to look at the tasks now in week 4, just to give you an outline of what you need to do now. Lesson 1 in the week 4 is going to be to list the 8 steps of the emergency procedure, which we've discussed. The injuries that take precedence over all the others, we know what those are. Those are the main ones, critical injuries. The list of the 5 most common signs and symptoms of emergency situations. We've looked at that again, signs and symptoms. And then we've got a list of the 5 most common signs and symptoms of emergency situations. And after immediate threats to life have been removed, a secondary examination is necessary. This is a systemic examination starting from the head down to the limbs. Describe it in your own words. All right. And then you got to, what could be the result from administering rescue breath procedures in the same way to an adult as to an infant? So this obviously is now, you obviously need to do it separately. What happens if you do that to an infant? What could it do? And again, you know that it could do a lot of damage to the chest, to the, the infant's got a much smaller volume capacity lung, etc. Discuss responsibilities of first aiders. Okay, these are all in your notes. With assistance of a first aider, list the different types of injuries that could occur in the workplace with customers or staff. So think about this. You don't have to use the assistance of a first aider. You can do it just from your notes or from reading up. In your own words, discuss the CPR procedure in terms of the 13 steps. We've looked at that in week 2. And in organizing assistance, under what conditions should you call emergency services? Look at all those conditions of emergency services: poisoning, heart attack, critical conditions, etc., etc. You can get that in your notes. When the emergency staff arrive, what information needs to be given to them on arrival? Okay, we did that in the first week. In your own words, explain how should all emergency situations be reported and documented, again in your notes. And then attach samples of an injured on duty form and an accident report form, and state the purpose of each form. So we haven't really done this. This is a bit of homework. This is a bit of your research. Here you will have to, you can get it from the internet, or you can get it from your colleagues. You can get them to assist, and then obviously write about what that does. And that is it. So that is really your first aid course. and that would be your assessment, and you need to submit this assessment in the 4th week. Make sure that whatever you don't have in your notes, which is very little, you do read up about and you get the relevant information so that you can put that in. Good luck, and hope you enjoy the first aid course, and hope your students enjoy it as well.